This morning represents the culmination of 2 semesters of work in trying to understand the science and the management issues related to new environmental proposals. Some of these are actually coming out of the United States federal government, which is something that we'll mainly be thinking of in historic terms in a few months. Remember when the U.S. had a government, things like that. But in any event, despite that, the structure of environmental law will persist. The political institutions will continue to thrive, frankly, and you'll see the strength of those institutions demonstrated, including the structure of American environmental law, which is still quite robust despite the absence of new law since 1990, with the exception of the Toxics Act, which the chemical manufacturers decided to let get approved this past year. And in that case, it was because the states were passing laws that were more rigorous than the federal law, and they wanted some uniformity across the states. But we're in a field that is growing in its importance, and what you've learned is incredibly important. And this is a period of time when it's really important to persist and to keep pushing. As I said to a group of SEPA alums yesterday, we went through a period like this in the early 80s when the Environmental Protection Agency was under attack. And one of the things that happened at the grassroots is that people remembered they liked to breathe, and that clean air and clean water were not ideological, they were in fact biological, and that everybody needs them, and that tendency will not change. We're going to continue to see that supported. So I have a high level of confidence that your skills and your ability will be very, very important in the coming years. So with that, why don't we get started on our briefings today? We're going to start with the group that struggled to deal with my advisorship, and Kevin will talk to you about getting the lead out. So Kevin?
Good morning, ladies and gentlemen. According to the CDC, 8 million American children are exposed to a toxic level of lead that could have detrimental and irreversible lifelong health effects. Currently, at least 500,000 children between the age of 1 and 5 have lead within them that are above the EPA standard. My name is Kevin Cheng. Today, on behalf of my group, I'll be discussing the problem of how lead is an issue within the drinking water, especially within low-income communities. Before I continue, I want to thank our advisor, Professor Cohen, for his guidance and support, and I want to thank our team for their hard work. Today, I'll be answering some questions concerning how lead is a problem in our drinking water, how Get the Lead Out Act addresses these problems, and what we aim to accomplish, as well as how we will measure the success of the act. In addition, I'll discuss what other actions are needed to address this problem in its entirety. To start off, lead is a heavy metal, toxic upon exposure. Lead exists within our surface water lines and can be carried into our tap water. Once lead enters our body, it stays within our body and cannot be removed. Lead affects all organs and functions of the body. Unfortunately, lead affects children more severely than adults. During a child's developmental period, once a child is exposed to lead, like in Flint, Michigan, a child could lose IQ equivalent to an A student to a C student. Disastrously, this issue is not limited to Flint, Michigan, but rather a nationwide problem. In this map here, you can see how extensive the problem is. The darker the red, essentially, the more people are affected by lead. In response to this issue, our act was introduced early this year by Senator Benjamin Cardin. the Act aims to provide grants and education to homeowners that are exposed to lead in hopes of America drinks only from unpolluted taps. The grant that is within this Act will be given to cities to replace their contaminated public service water lines, and financial assistance to low-income communities to replace their private service lines. This Act prioritizes low-income communities as well as children, both of whom are disproportionately affected. So what's actually within this Act? The Act provides $60 million each year from 2017 to 2021. There are three options of how we can allocate the fund. Option one is through infrastructure replacement. This will allow cities and communities to replace their contaminated water service lines, which are usually the main source of contamination. Option two is planning grants. Planning grants will kickstart the initial planning stage for communities to determine how and what they need to do to address this issue. The last option is educational programs. This will be focusing on educating the public, increasing public awareness on the lead issue. In perspective, to replace an entire community's water service line, like in Flint, Michigan, is estimated to cost billions of dollars. So $60 million is clearly not enough to replace any city's water service lines. With the given limitation, it is not enough to solve the issue on a nationwide scale. $60 million is only a drop in a bucket. However, every drop counts. It is possible to utilize the $60 million in an effective way of addressing the issue. The EPA will need to hold a criteria of maximizing lead reduction while minimizing the cost. Simply put, there is not enough to support large-scale nationwide pipe replacement. Rather, the EPA should focus on allocating funds towards planning grants. Planning grants will act as seed money, allowing communities to determine and define what they need to do to address this issue properly. Alongside planning grants, the EPA should focus on allocating funds towards educational programs. This will actually start addressing the issue on a nationwide scale. Under the Act, we recommend allocating $1 million planning grant to 50 communities in the first year. That will total to $50 million in the first year and $250 million over the next 5 years. Additional $4 million should be spent on educational programs, and this will total to about $20 million over the next 5 years. Considering the fact we may not actually get the total $60 million, we have limited the administrative cost to about $1 million per year. Under the Act, the EPA is recognized as the administrator. They are responsible for implementing and essentially kickstarting the grant program under the Act. After reviewing the EPA structure, we believe it is logical to house the lead program within the Office of Water, specifically the Office of Groundwater and Drinking Water, given their shared objectives. There will be a task team consisting of 4 members, a full-time team leader, as well as 3 part-time personnel, as illustrated in this graph here. The program is designed to heavily depend on contracted staff in line with our principle of minimizing the cost. Contractors will be responsible for a variety of tasks, including, but not limited to, promotion of the program, application review, data analysis, and data collection. So what do we aim to actually accomplish in the first year? Our objectives for the first year is broken up into 3 parts. Objective number 1 is to facilitate local planning objectives. We will do this in 2 folds. Number 1, by announcing our program to the public, and number 2, by allocating grants to 50 communities throughout the nation and 250 communities over the next 5 years. We want to do this to encourage political action and political drive to further tackle this lead issue. Our second objective is to begin community outreach. We'll do this by increasing public education programs, again, increasing their awareness on the lead issue. Our last objective is to establish an internal monitoring system. This internal monitoring system will act as feedback for us to improve the program overall. This feedback mechanism will allow us to better review application and understand the progress of the program. We have identified 3 indicators of success. Number 1, the number of applications we get. Number 2, the geographical distribution of applications. And lastly, the speed in which we will review and approve lead grant money. These indicators will improve our understanding and utilization of grant money, and improve our overall objective of reaching 250 communities and implementing a successful educational program throughout the nation. Imagine us reaching 250 communities. Imagine how beneficial and influential that will create for this issue. To be able to reach the 250 communities and to be able to improve the lives of millions through our program, we have already taken that first step of addressing the lead issue. However, to tackle the issue, more needs to be done. There needs to be a comprehensive strategy on the federal, the state, and the local levels. The strategy will need to include additional funding for existing programs like ours that are already tackling this issue. Additionally, more interest is needed from the public, as well as more buy-ins from different stakeholders, as well as different industries and sector. Only with a comprehensive strategy can we truly begin to solve the lead contamination in our drinking water. Thank you.